Abusing Suboxone. If you are struggling with opioid abuse, there is a good chance you have heard of Suboxone. This medication is used to help people overcome their addiction. It has become increasingly popular and effective for those suffering from opioid addiction in recent years. While Suboxone can be a helpful tool in recovery, it can also be abused if not taken as prescribed like other controlled substances. Abusing Suboxone can have serious consequences, so understanding the risks involved before taking this medication is crucial. This video will discuss how you can detect if someone you love is abusing Suboxone and the right way to take it. Suboxone is used to treat opioid addiction. It combines two drugs, buprenorphine and naloxone. Buprenorphine is an opioid partial agonist, which binds to the same receptors in the brain as other opioids, but produces a weaker effect. Naloxone is an opioid antagonist, which blocks the effects of other opioids. Suboxone helps prevent withdrawal symptoms and cravings in people trying to quit opioids. It can help prevent relapse in people who have already stopped using opioids, but are at risk of relapsing. Suboxone is generally safe and effective when used as directed. However, some people abuse Suboxone by taking it intravenously or snorting it. It can lead to severe withdrawal symptoms and even death. People abusing Suboxone often do so because they believe it will help them get high, or they want to self-medicate their withdrawal symptoms. However, abusing Suboxone can be just as harmful as abusing other opioids. If you or someone you know is struggling with addiction, please seek help from a qualified medical professional. Suboxone is frequently abused because it can be traded or sold for other drugs on the black market. Some inject for Subutex, or take it orally at higher than prescribed doses. People abusing Suboxone are usually seeking high or euphoric effects. They typically have a history of drug abuse. They may take a larger than prescribed dose to create a similar high with other drugs like OxyContin, heroin, fentanyl and Percocet. Suboxone abuse can lead to dependence and addiction. It can also cause serious side effects, including respiratory depression, seizures, and death. Treatment for Suboxone abuse typically includes detoxification and behavioral therapy. It can prove difficult with limited access to treatment in most areas, primarily rural areas. Suboxone and Subutex are medications used in medication-assisted treatment (MAT) for addiction. They contain buprenorphine, a partial agonist that prevents withdrawal symptoms and cravings in people who are addicted to opioids. Suboxone also contains naloxone, which is an antagonist. It reverses the effects of opioids. If someone tries to abuse Suboxone by injecting it, they will experience precipitated withdrawals because of the naloxone. It is often a reason Suboxone treatment is preferred over methadone treatment. Meanwhile, Subutex does not contain naloxone. People abuse Subutex by crushing the tablets to inject or snort them. On the other hand, Suboxone comes in the form of films dissolved under the tongue. Therefore, it is more challenging to abuse it than Subutex. However, it does not mean Suboxone cannot be abused. People can still abuse Suboxone by taking more strips than prescribed or by mixing Suboxone with other drugs like Xanax and alcohol, leading to an increased risk of opioid overdose. Abusing Suboxone can have many signs. The first sign is showing withdrawal symptoms. If your loved one is abusing Suboxone, they may start showing withdrawal signs when they try to quit taking the drug or lower their dose. These withdrawal symptoms include flu-like symptoms, anxiety, depression, and irritability. Another sign a loved one may be abusing their Suboxone is if they frequently run out of medication. If your loved one is abusing Suboxone, they may run out of the drug before their prescription is due for a refill. It can signify they are taking more than prescribed. Worse, they might be selling their medication. Another sign of drug abuse from someone on Suboxone or Subutex is injection marks. If you notice your loved one has a fresh needle mark on their skin, it could be a sign that they are injecting drugs. Injecting drugs can increase the risk of contracting HIV or hepatitis C. An additional common scenario for those abusing Suboxone is financial difficulty or instability. If your loved one is abusing Suboxone, you may notice them asking for money more often or taking money from you without asking. It can signify they are spending money on the drug instead of other necessities like food or rent. Last, those abusing Suboxone may appear to be intoxicated. If you notice your loved one appearing intoxicated during the day or frequently, it could be a sign they are abusing Suboxone. Intoxication from Suboxone can lead to dangerous behaviors like impaired driving, slowed reactions, and mood changes. It is particularly dangerous because Suboxone abuse can lead to blurred vision. If you notice any of these signs in your loved ones, talk to them about it and get them the help they may need. Other signs and symptoms to look out for are slurred speech, dilated pupils, pinned pupils, nausea, vomiting, sweating, dizziness, muscle aches. Suboxone is a prescription medication used to treat opioid addiction. It is a powerful medication that must be taken as prescribed and supervised by a qualified doctor. It can help those suffering from opioid use disorder from opioid cravings. You can search for Suboxone clinics at suboxonedoctor.com if you do not currently have a Suboxone provider. When taking Suboxone sublingual films, regularly visiting your doctor is critical to ensure the correct dose is being taken and maximum relief is achieved. You may also undergo a drug test to ensure Suboxone is in your system and the absence of illicit substances. Those who abuse Suboxone or mix it with other illegal substances risk serious health problems, including overdose. If you or a loved one is struggling with Suboxone abuse, please know that help is available. When searching for treatment options for opioid use disorders, you want to ensure you are addressing the issue's physical aspects and the behavioral health factors that can cause your addictive behavior. Visit suboxonedoctor.com today to find a Suboxone provider in your area who can help you get on the path to recovery. Remember, it's never too late to seek treatment and start living a healthier life.